Med Ed Bytes. Micro. Just-in-time education. Hi, this is Dr. Zahn Sentimol, Assistant Professor at the University of Louisville School of Nursing, and I'm here to guide you through this Med Ed Byte. In this bite, we'll explore intraoperative considerations for minimizing the risk of postoperative cognitive disorders. Intraoperative management plays a crucial role in preserving cognitive function. A key strategy is avoiding deep anesthesia. Maintaining adequate but not excessively deep levels of anesthesia, guided by processed EEG monitoring, minimal alveolar concentration, and vital signs may help reduce the risk of postoperative cognitive issues. This approach aims to provide sufficient anesthesia for the procedure while minimizing potential neurocognitive impacts. Hemodynamic stability is paramount. Avoiding intraoperative hypotension and maintaining adequate cerebral perfusion pressure is essential for preserving cognitive function. This involves careful monitoring and management of blood pressure throughout the procedure, ensuring that the brain receives adequate blood flow and oxygen supply. Optimizing oxygenation is equally important. Preventing cerebral oxygen desaturation through careful monitoring and management of oxygenation helps maintain optimal brain function. This may involve adjusting ventilation parameters or oxygen supplementation as needed during the procedure. Temperature management is another critical factor. Maintaining normothermia may help preserve cognitive function, so avoiding intraoperative hypothermia is recommended. This often involves using warming devices and carefully monitoring the patient's core temperature throughout the surgery. Implementing multimodal pain management strategies is crucial. This includes using regional anesthesia techniques and non-opioid analgesics to minimize opioid use, which is known to contribute to postoperative confusion. It's advisable to avoid long-acting opioids and benzodiazepines, especially in elderly patients, as they are associated with an increased risk of delirium. Instead, shorter-acting agents and alternative pain management techniques can be employed to provide effective analgesia while minimizing cognitive side effects. Careful medication selection extends beyond pain management. Avoiding anticholinergic medications when possible is recommended, as they are associated with an increased risk of cognitive decline. Some studies suggest that dexmedetomidine may have neuroprotective properties and reduce the incidence of postoperative delirium, making it a consideration for sedation in appropriate cases. Fluid management is another important aspect of intraoperative care. Implementing goal-directed fluid therapy to avoid both hypovolemia and fluid overload can help maintain optimal cerebral perfusion. This involves carefully balancing fluid administration based on the patient's individual needs and physiological responses during surgery. Lastly, implementing fast-track surgery protocols and enhanced recovery after surgery (ERAS) principles can promote early mobilization and recovery, potentially benefiting cognitive outcomes. Even the duration of surgery matters, with every additional hour of surgery associated with a 12% greater risk of postoperative delirium. These approaches focus on minimizing the physiological stress of surgery and promoting rapid return to normal function, which may help preserve cognitive abilities. It's important to note that while these strategies show promise, the evidence for their efficacy in preventing postoperative cognitive disorders is still evolving. A multimodal approach tailored to each patient's individual risk factors is likely to be most effective. This may involve combining several of these strategies based on the specific needs and risk profile of each patient. As our understanding of postoperative cognitive disorders continues to grow, these intraoperative considerations will likely be refined and expanded. Medtronic, engineering the extraordinary.